Oh. Oh.
Hello, everyone. Today we have Dr. Sarah Psillas talking to us about seating and positioning. Before we get started, does anyone have any questions about their caseload that they'd like to ask? Any pressing questions?
No, not currently.
All right. Well, Dr. Psillas, please fire away.
All right, so I tried to make this presentation versatile. I'm going to minimize this if I can. Okay. I tried to make this versatile for a lot of different people and populations and the various resources that you may have access to. So I am going to start with some more of the basics about seating and positioning and wheelchair evals, and then I'll go into some creative solutions that might be helpful in your day-to-day practice. So just quickly, I just want you to be able to identify components of a wheelchair evaluation, the order in which seating and positioning should be addressed when you're doing a wheelchair eval or trying to reposition someone. And then finally, to be able to be creative in different ways you can help improve posture, whether that's in a seat or in a wheelchair. And I also have some resources on how to access mobility equipment. So best practice for wheelchair evaluations, you want to include, the identifying information about your client or patient and things such as their age, their height and weight, diagnosis, and any related conditions that are relevant to the need for a seating and positioning system, whether that's, again, a chair, a stander, a wheelchair. Insurance or payment information may or may not be applicable depending on where you are and where you are looking to get the seating system from. Like I said before, at the end, I do have some resources that are helpful for places and companies that will send you seating systems. So they might need some sort of information about the client in this area. Again, you may or may not need a referral source depending on how you're getting the chair or the seating system. And then you want to know about their living situation and anywhere they plan on using the seating system or wheelchair to help plan for what that might look like. So some of the physical things you want to think about when you're doing your evaluation is you really want to get your client on some sort of flat, hard surface, whether that's a mat or some sort of plinth or any sort of, what you want to avoid is a bed or something that sinks in, right? Because it's really difficult to get true and accurate measurements when you are on a surface where they sink in and are getting support from the surface they're lying on. So you want to look at them in a general manner and look at their alignment and see, is their spine straight? Are their hips aligned? Do they have any rotation or tilt in their hips? And what does that look like? Can they bend their knees and get into hip flexion at the same time? So that's important because that's really the seated position that you're in, right? When you're in a seating or positioning, whether it's a wheelchair or whatnot. You also want to know about their skin integrity and if they've had any issues or current pressure areas. So if they have current ones, you'll be able to see them. But if they've had a history of any wounds, or even if they get rashes easily, like behind their knees or on the bottom of their feet, those are all things that you would want to know. You then want to look at measurements and see if you have the option to get different sizes. This is where that would help. It also might help when you're thinking about how much support you might need to provide your client. So things like sitting balance. So can they sit unsupported, or how much assistance do they need? You want to look at how aligned their trunk is, again, now in sitting. And then if you can reposition them, if they're sitting, can you move them into the position you want? So we call that flexible deformity versus fixed, which I'll talk about in just a moment. You also want to see where their arms and their legs are when they're in a seated position, and also if they're able to relieve pressure on their own. So are they able to essentially push up and lean from side to side to rearrange their bottom? So if you think about, if you're sitting in a chair for a long period of time, you don't stay in one position for that entire time. Maybe you put one leg over the other, or you put one leg under your bottom, or you shift your weight left or right. So you want to see if they can do that as well. These are specific wheelchair measurements, and if you would like more information on this, I can provide that to Kate, and she can get that information to you. But essentially, these are the different areas you want to measure when you're measuring for a wheelchair. So these will help you make selections if available. And so again, I can give that actual document to her if you're interested. And then the last piece of a wheelchair evaluation is really the functional piece, right? So what types of ADLs or self-care do they need to perform while they're in the seating system? Will they be, bathing in it, or will they be transferring to some other, like on some other chair to bathe? How are they going to get in and out of the chair? Is there someone that's going to help them? Can they do it on their own? Things of that nature. And then what kinds of things do they need to do in their environment, right? Their home, are they working, driving? Are they cooking or cleaning, or whatever else they might need to do while they're in their seating and positioning device? And then finally, what kind of assistance or caregivers do they have? What kind of help do they have in case something goes wrong, or it breaks, or they can't reach something, etc. All right, so before I move forward, I just want to check in and see if anyone has any questions. No? Okay. I don't know. I'm gonna mute. Okay, can you mute?
I'm all good.
Okay, perfect. All right, so I'm going to move on. So there's really two different types of deformities. So there's flexible and there's fixed. So flexible means essentially that you can provide assistance and get them into a better position. So that's what we're going to focus on today, because the other is fixed. And essentially that means you can't correct the position that the person is in. And so you really need a custom system, and that's not really the focus of what we're talking about today. But if you do have someone who has a fixed deformity, you want to make sure that all the body parts are supported, that their pressure is distributed equally as possible, and that's not just for their bottom, that's for their arms, their legs, their feet, and that you're not using a lot of force to correct anything, because you won't be able to correct it. So again, we're going to focus on flexible deformities. So usually this is very interactive, this conversation I have, so I'm going to do my best to do it without the interaction. So you want to start proximally and move, or I'm sorry, you want to start out, proximally and move distally. So it's really important that you focus on the midline and move outward. So we always, always, always start with the person's pelvis, always. If you think about positioning and you're sitting, if you move your pelvis, your spine might have moved, your upper extremities might have moved, your head might have moved. So you always, always start with the pelvis. if you were to start, let's say, with the head or the spine, and then you correct the pelvis, the likelihood of you moving the position you just put the spine and the head in are going to then be different, and you'd have to go back and fix them again. So we always start with the pelvis, the spine and the hips, and then we move to lower extremities, upper extremities, head and neck. And I'm going to go through each of these steps separately. So first, always correct the pelvis. So you want to make sure that the pelvis is as level and stabilized as possible. And really in any seating system, whether you use a chair that you already have, or a lawn chair, or a wheelchair, or whatever you're using, you want to make sure there's a solid surface below anything that you're putting on top of that. So if you have a cushion or pillows or whatever you're using, you need to have a solid base. The pelvis should always be all the way back in a seat, and you want to try to get into the most natural position as possible, so a slight anterior tilt. Now, that doesn't always happen, so again, you want to get into as close to a natural position as possible. When you're correcting a flexible deformity, you want to correct for any of those deformities that you found during your wheelchair evaluation. So an obliquity, where one side of the pelvis is higher than the other, a tilt, where it's either, too far anterior or posterior, right? You're trying to correct that. And then rotation. So maybe it's turning towards the left or turning towards the right. So once you correct that, you want to provide something to stabilize it. So if you have contoured cushions, they're a great option. If not, there are different ways that you can use, well, I'll get there, but you want to create some sort of contour to keep the pelvis where it is. All right, sometimes you have to use a little bit stronger of a correction. And so what I mean by that is sometimes you might have to put padding under one side of the pelvis and not the other. So that would correct for an obliquity. Or sometimes you might want to put something, they're called pelvis blocks, but essentially you could do this easily if you had any sort of like stiff foam or cardboard or something like that. They would just hold the hips in place. And so the image on the right with this arrow, I don't know if you can see my mouse, but the one with the arrow on the right is the one that I'm talking about with pelvis blocks. You also might need to have what we call pelvic stabilizers. So in the United States, we cannot call them seat belts because they're considered a restraint. So we call them pelvic stabilizers. So it obviously would depend on the country where you are practicing, but you really, really do not want the image A. So A is essentially across the waist. And what happens, as you can see in this picture, is the individual is slumped over in a very kyphotic position. And obviously that's unsafe, right? A lot of times these are the people that sort of, quote unquote, fall asleep in their lap and obviously could fall forward in their chair. B and C are really the two most common, and honestly, I would say B is the most common. So C is really for people who have like a spinal cord injury and have really, really good use of their trunk and upper extremities. However, most people that you are working with probably don't have awesome strength in their trunk and upper extremities. So B is really the best option. And it's really like a seat belt in a car, right? The angle, that 45-degree angle. And this just holds the pelvis back in the chair and also in the position that you want. The second thing you want to address is hips, and you just want to make sure they're aligned. So this image, while not fancy, I think shows really what you want to try to obtain. So the one on the left is when the hips and the pelvis are in alignment. Okay, so they're neutral, there's no rotation. The thighs are fully supported, and the pelvis is still aligned, right? It didn't change the position of the pelvis. So, and then the one on the right is an example of when the thighs are aligned, but the pelvis is not. Next, you want to move to the spine. All right, so the spine, you want to make sure that it's aligned in midline. You want to have the normal curvature of the spine. So, right, a slight lumbar lordosis, a slight thoracic kyphosis, and a slight cervical lordosis. So the normal curves of the spine. And then you want to keep the person upright. That's what I mean by extended, not in that kyphotic, slouched position. So in order to do this, you want to try to provide a firm back support. So a lot of people are familiar with lumbar supports because they're sort of marketed towards the general population. So you could use something like that if you have access to that. I'm going to show you another example later on in the presentation. You also might need to provide lateral support, so providing support either on their left or their right side to keep them upright. So there's a lot of different ways you can do that. And then if the head and neck look good after you've corrected the spine, then you don't need any sort of head or neck support. However, if they look, they're off to the side or they're slumped forward or backwards, then you might need some sort of head and neck support. This example is of a person who leans to one side. It's actually for scoliosis specifically. I'm going to move this so you can see it all. Okay. So when you're working with someone who has scoliosis or leans to one side, these are suggested placement areas for you to place lateral supports. So you want to make sure the pelvis is stabilized. So you can see here that this person on the left needed both sides, and this person on the right only needed on their left side. They also needed a buildup under their right side because they have a pelvic obliquity. Okay, then we're going to call this an apex, but essentially where the curvature of the back is pushed outward, you're going to put a lateral there to help correct that. And then just under the armpit on the opposite side. And that should help correct them and get them into an upright position. You also can use strapping for the spine. You just want to be careful with how much, if clients are okay with it. A lot of times clients don't love straps. I don't know what I just did. Okay. They don't love straps. But it's an option. I honestly use this a lot more with kids than I do adults. So H strapping or X strapping is the best. So they just look like the letter H or the letter X. They're definitely safer and more controlled, and you never want to do a Y, and that Y is that bottom image. And we want to avoid Y because when people slouch or if they were to fall forward in their chair, it can be a choking hazard. They don't tend to hold people upright as well. All right, the next step is the lower extremity in the foot. So ideally, in an ideal world, which we all know is not always possible, we want people to be seated in a 90-90-90 position. So 90 degrees hip flexion, 90 degrees knee flexion, and then 90 degrees at the ankle. So while this is not always possible, again, you want to try to get them as close to this. That being said, most of us don't sit in a 90-90-90 because, frankly, it's not quite very comfortable. So remember that too as well when you're positioning someone. But essentially, you want them in this neutral alignment, and you want their ankle to be directly below their knee, and their foot should be fully supported if possible. And that doesn't mean that you need a footrest or leg rest. It also could be that they have the floor for their feet. A lot of people like to use their feet to help move in their wheelchairs. So it's fine if that's their mode of transportation. And then finally, the upper, well, possibly the final part, depending on the head and neck, but you want to do the upper extremities. Provide support if possible. I found these two images online just to show you the differences in posture when the person has armrests or some sort of support for their arms and when they don't. So the image on the top with the gentleman in the pink shirt, he has no supports for his arms, and you can see that he's in a slouch, kyphotic posture. His pelvis is starting to tilt more, and it's not the greatest position. And then you can see the gentleman at the bottom with the striped shirt has arm supports, and you can see he's much more upright. You can't tell, but his pelvis is further back in the seat. And so you want to try to get that 90-degree elbow flexion if possible. You just don't want to restrict their movement in their arms to complete the tasks that you would ask them they need to do, right? Bathing, dressing, their job, right? Anything they need to do. And then lastly is head alignment and support. So the image up here, these are really fancy headrests. And I'm not going to spend a time going into these necessarily, but I just wanted to give you an idea of the different shapes of headrests. And so if you're trying to configure something that would be supportive, these are the shapes you kind of want to get if possible with the materials you're using. So remember that I said before that not all people need head and neck support, especially after you correct their spine. You should be able to tell if they can hold their head upright without any support. Or if they're sort of, you know, their head is bobbing or going from slow.
None for
Check. I can't check the chat box. Good. Okay, I'll keep going. All right. Excuse me. So this is just a review of wheelchair terminology. I just threw this in there for reference. And so if you have any questions, I can get you the link to this if needed. All right. So I want to get into creative solutions. So the one thing, if you are working with wheelchairs a lot, and even if they're donated wheelchairs or ones that aren't, you know, they're more basic and they're not fancy or custom chairs, this one tool is really your best friend. And so when I worked in a wheelchair clinic full time, well, that was most of what I did. It was a skilled nursing facility, but I did mostly wheelchairs. I kept one of these in my pocket at all times. So some people call these Allen wrenches, some people call them hex wrenches. And so if you have the availability to them, it's really your one tool, because any wheelchair that's donated or custom or are pretty much adjusted with this one tool. All right, so a couple of materials that could be useful, and I'm just going to give you some examples of how you could use each of these materials. So the two belts on the left, so one is more of like a Velcro strap, and that could be used for, you know, a pelvic stabilizer, could be used for a chest or trunk belt. And if you don't have access to Velcro, a belt that goes around your waist you could use as well, to do both of those things. So correct and stabilize the pelvis, and or around the chest to help stabilize the chest. You just want to remember with some of these materials that because they're not specifically designed for wheelchairs or positioning, that you need to make sure you pay attention to the client's skin integrity. These obviously can dig in to someone, and you know, if they have swelling or they're older and have really thin skin, you want to make sure you're paying attention to that. Another great resource are pillows, and then the image at the top is really pillow stuffing. A lot of times I have interacted with people who have done some therapy without borders trips, and I said, what is the one piece of advice you would give someone? And she said, pillow stuffing. She said they used it constantly. So you can take a pillowcase or an already made pillow and put more stuffing or less stuffing to help position someone. So that is a good trick. So you can have previously made pillows and add to it, or create your own. These two pillows at the bottom, one is more of like a head neck pillow, sort of like when you travel, that you could put in the back of someone's seating system to help them either help with their lumbar spine area or their neck. And then the pillow below it is like a lumbar support pillow. And so you could use that at their, at the lumbar part of the spine. Some other really awesome materials, pool noodles are a great resource. So most of the time, well, you can use them as they are and cut them into smaller chunks, or you can cut them in half the long way. And I'm going to show you some pictures of the use of pool noodles in a second. But they're great because they're soft and they won't cause too much pressure on the skin. And a lot of times people attach them with a zip tie. And so zip ties are great. You put them on, you tighten them as much as possible, and then you snip this little pointy end off. And then I would suggest putting like a little piece of tape or duct tape or something, or glue even, over it, only because that area that the zip tie is cut can sometimes be sharp. Another great resource are towels. I use towels a lot with kids who are in car seats, mostly around the head, because we can't do it around their pelvis because that negates the safety of the car seat in the US. But it's great for that. It's great for if someone has a chair at home, but they can't quite get in the right position. You can kind of move them. You can either roll them and wrap them in duct tape to keep them in the position you want, or you could put them in a pillowcase. There's a lot of ways you can incorporate towels. And then this bottom image is a bungee cord, but it is like a flat bungee cord, not a rope one. And I'm going to show you how it can be used to help with holding feet on and legs onto a leg rest. Styrofoam is also great because you can cut it with a knife and cut it into any shape you need. Also, the thicker cardboard, more like a craft cardboard, is another great option because you can layer it and glue it together or tape it together. And then that creates a really awesome solid seat surface if you need something to have a level seat in your seating system. And then duct tape is just great. I love duct tape. But it's great to wrap around like cardboard so that it's waterproof. It's great to hold things in position. So duct tape is my friend. So I don't know if you guys have seen these. There's a lot going on about lawn chair wheelchairs, and there are a lot of there is one company that I know of that will donate them. But I also found this do-it-yourself wheelchair, plastic wheelchair. So I gave you the link right here. It goes directly to this image and all the things you need and the steps to create it. So I thought that was an awesome resource as well. So this is what I was talking about, pool noodles. So this is a child's chair on the left-hand side. So this would be for a kid who maybe doesn't have good trunk support, tends to slide forward in their chair. And so they took the pool noodles and essentially made higher back with more support. And the front right here is like a loop, and then almost like a pummel, like something in the middle to keep them from sliding forward. So the loop around gives them upper extremity support, trunk support, and then the piece in the middle helps them stay upright and not slide forward. On the right is an example of a lawn chair that, again, these are pool noodles. So these ones were cut in half the long way, like I was saying before, and they're all tied on by zip ties. So this back piece gives some extra support to keep them upright, and then the ones on the side could help keep them upright as well. It provides lateral support, and then the front piece right here is actually, it's hard to see in this picture, but when the person sits, it actually brings their hips all the way back in the chair, almost at a slight angle, so that they can keep their pelvis all the way back. It also has the centerpiece that's sort of like a pummel to keep their legs separated so they're not getting constant pressure between their knees or their thighs, which can cause skin breakdown as well. So one of my previous students has been going on a therapy trip to Jamaica every year. And so I asked her to send me some pictures of the things that they have been doing. And so these are some images of some kids and adults she's worked with. So this little boy on the left, he has a seating system, but he was falling out of it. And so they took these 2 pool noodles and they wrapped it. You can't see it behind his head because I had to blur out his face. But they wrapped it around, and then they put a Velcro strap around to hold him upright. So that now they put, this is just like a piece of that, like really thick cardboard for like a desk, a lap desk. And so now he can sit upright, and he's writing his name here. So it was much better than before because he was leaning forward and couldn't do any fine motor activity because he was slouched. And then the image on the right, they are working on, so this was a donated wheelchair. You can tell because it's multiple colors. So the seat piece of it worked pretty well for this young adult. But the foot plates, these footrests down here, were way too long. She couldn't get her feet to touch them. And so you can see the girl sitting with the pink pants, she's cutting up a towel, and they were folding the towel over and over on top of itself, and then they taped it to the bottom of the footrest so that her feet would touch the footrest. And then this last image is of a man who they had gotten a wheelchair donated for him, but it didn't fit him well at all. So there's a lot of cool adaptations they did. So the first is around his chest. So it's a Velcro strap that they put around him. And then under his bottom, you can see they put a towel and then a pillow to raise him up a little bit. It was too low for him. And then his feet touched, but they were really worried about his skin touching the leg rests, or calf plates is what they're called. And so they put this pillow behind him. They also stuffed extra pillow filling into that pillow, and then used bungee cords, the flat bungee cords, to hold his feet in place. So again, just a reminder that if you're using like bungee cords or things to hold, or belts to hold people in a certain position, to make sure that you're, checking their skin, or their caregivers are checking their skin to make sure that they can tolerate it. So this is a list of resources. So these different companies donate wheelchairs to different parts of the world. Some of them have certain missions or certain populations that they like to help, but others, their mission is to help anybody who needs, wheelchairs. So I thought that might be a good place for you guys to start if you were looking for this for your clients. So that, and again, all over the world they donate these. So, and then lastly, here is my contact information. If you are watching the recording or you think of a question later on, please feel free to reach out to me. I'd be happy to answer any questions. If you have, a client you're working with and you're not sure what to do with them, or anything of that nature. So with that, does anyone have any questions?
Well, thank you, Sarah. That was really good.
Oh, I'm glad. I hope it helped. It was helpful.
I don't really have any questions. Because some of the stuff that you did go through, are some of the things that we were taught. Sorry for the mic. Just a little bit differently. We were taught it, and not as I guess extensive.
Mm-hmm.
So we do know some of the criteria in terms of what to look for when you're providing a wheelchair to a patient. One of the good things I liked is that how you showed us to modify it, like some of the ideas, which was really great because sometimes it doesn't come to you right away.
Sure.
So, but currently the place that I work right now, because I'm on my last set of rotation with work, we do a lot of wheelchair assessments because I think it's a church in the US that donates every few months that they donate wheelchairs. So the assessments are done pretty often, and adjustments are hardly made by myself. We have the technicians that are trained for that. They're always there. So adjustments are hardly made by us.
And are they, when they make adjustments, what are they using to make those adjustments?
Well, when I mean adjustments, like for some of the wheelchair that we currently have, the seating height can go up or come down. The footrest is adjustable. For some, whether they need a armrest or not, it's depending on the type of wheelchair. It can come off or stay on.
Mm-hmm.
In terms of, they come in specific sizes, so we try to fit the patients as close to the sizes as we can while making sure that they understand that they need to do pressure relief. They need to, if it's too tight, they need to let us know. If it's too big, they can put stuff like pillows or a towel, which some patients do on their own without you even telling them. But that's it so far.
Do you have any rules or regulations on what, if you have the option to give different sizes, what that measurement should look like? Or do you guys do it by looks, or how does that?
No, we do a complete assessment. We need to know how the person got, like, what are their condition, how they possibly got their injury, what is their home like in terms of the kind of surfaces that they have, their doorways. If we can, we try to make those visits. Some of those areas are really out of bounds for us, so we'd have to take patient's word for it. In terms of how they're able to get around, if they need to go to clinics or they need to come out, who's home with them, what is their basic living situation is like. If, like you said before, if they can sit in a upright position, basically 90-90-90, there's a little bit of flexibility room in terms of the 90-90-90. But we try to keep us as close to it as possible currently. But yeah, and if they've ever had, we take history in terms of if they've ever had pressure sores, of ulcers, if they're diabetic. We try to make sure we just note those down on the form that we use.
That sounds great. I mean, there are, a lot of, specialty cushions and lateral supports and all of that. But I also want to, I feel like that information is out there. When you look up, adaptations for wheelchairs, that sort of is what comes up when you search for that information. So I wanted to give you some ideas of other ways to do it without, those adaptations are very expensive. So there are a lot of really creative and less expensive ways to do things. But it sounds like you were doing great work.
So far, we've never had at least I've never encountered a patient that needed head support. Most of them need, especially the ones that are elderly, they do need the lumbar support.
Mm-hmm.
But other than that, most of the time they just needed to get from point A to point B. We of course teach them how to do transfers. We teach the relatives that if the patient does or can do it on their own, what are the correct positions in terms of helping, so those persons don't get injured along the way as well.
Awesome.
That is great. Do you have any questions about your current caseload that you'd like to ask?
Not that I can think of right now. So where I'm at right now is the pediatric center. Basically, there's a lot of kids we see as well as amputations right now. We're reassessing all our kids because there's also school at the back, so we need to reassess everyone. So I haven't gotten a complete grasp of who's there, who's not, because they're not always there in terms of when the school is out. So if I do, I will make sure to email.
Okay.
Yeah. Any questions, just feel free to email me, and I'd be happy to help with anything.
Thank you.
Well, thank you very much, Dr. Psillas. We appreciate your time.
You're welcome very much.
Bye-bye.